Improve healthcare services, we need to start at the root. Those taking care of us need to be taken care of first. The Health Professions Council of South Africa has expressed concern about the working conditions of health practitioners. The statutory regulatory is calling for an environment that is conducive, free of any form of discrimination and intimidation. The Council's President, Professor Simon Nyamatandane, joins me now for more. Thank you so much for your time, Professor. We do appreciate it. I think let's just start off with the gist of my introduction, where healthcare practitioners are working in very difficult situations and environments, but they're also possibly being intimidated. Tell us more.
Yes, indeed. Good evening to our viewers. One needs to start by saying, as HPCSA, we are saddened by the loss of life in East London. Indeed, the untimely death of these young boys and girls, it's unfortunate. We have no doubt that this loss of lives would have an impact in South Africa in the future to come, where we would have lost valuable human resource that would have to fill the gaps, be it in health, be it in social sciences, be it in the army, be it in the police system. So one needs to say we are saddened and condolences to all the families. Having said that, one would have to look at what is the current situation in our public facilities. We are concerned that we have got report from our health professionals who are indicating that the working condition is challenging in most of our public facilities, especially when we look at the shortages that are there and also the instrument or lack of equipment thereof that would enable them to render quality health services to all our South Africans. We are concerned, and we are really making a clarion call to all stakeholders to make sure that let's provide the resources that are required so that we can provide quality care to all South Africans. And that is the motto of the HPCSA, to make sure that all South Africans, when they visit public and private facilities, they've got quality health care, which is equivalent to all standards worldwide. Thank you.
It's a very worrying picture, though, Professor, and the reason why I say this is because if you look what happened to Dr. Tim de Meyer, he was suspended, and that suspension was then revoked after public outcry. But that case specifically speaks to the dire situation at, for example, Rahima Musa Hospital. You have a situation where children are dying, and this is what doctors are saying, that children are dying because of the state of that hospital. So the question is, I'm sure many other doctors are saying, I don't want to speak out because I could lose my job. And look what's happened to Dr. Tim de Meyer.
Well, it's unfortunate what has happened in that situation, but all we are saying, our health professionals, they have made an oath to make sure that they will protect the public, and where the equipment are not up to standard, they will not risk the life of South Africans. Let's put it this way. If there are no IC beds, or if when you are performing a normal operation and you are in theater and you know that there will be no resuscitation equipment, it is not advisable to embark on that procedure, because you would have created an environment where you have operated, and after operation, you are not able to guarantee the safety of the patient. So one would really have to make sure that in all our facilities, be it public and private, we are calling on all those that are responsible managers, leaders, CEOs, to make sure that our facilities are well equipped, especially now that we are moving into national health insurance, and to make sure that there is universal coverage for everyone. Our facilities should be working in such a situation where all the vacant posts, we know that there may be vacant posts, but there may be challenges that they are not funded. And if the posts are there and they are not funded, it's more or less the same problem that would have. Doctors would have to work long hours, nurses, all health professionals would be stretched to the limit. And that has an impact in terms of human body. We get tired. We could call it fatigue. You could make mistakes. You could have a lot of challenges that are there. So we are saying that situation that has happened, be it at Rana Musa Hospital or any other facilities, it's unfortunate, but the call is to all health facilities and the managers and the leaders to make sure that our facilities are up to scratch.
But do you think the leaders, stakeholders, the government, for example, the health MEC in this particular province, because of what happened at Charlotte Maxeke and a number of other provinces that their healthcare facilities are in serious deterioration, do you think they are listening? Do you think they understand the kind of environment and circumstances that not only doctors but patients are subjected to?
I have no doubt that all the MECs, the HODs, and CEOs of the different facilities, they do listen. And I think they're trying their best to make sure that the condition is improved. We need to take into consideration that the population is growing, the pairs is becoming smaller, and priorities are emerging here and there. It's a tight balancing activities that has to be done. But I have no doubt that in my interaction with few MECs and the HODs, they are committed, they are doing their best. It's only that here and there may be some gaps that needs to be brought to their attention that they may not be aware. But once they are made aware, I think they have to take a responsibility. And it's also for all other boards, the hospital boards, those that are there, they need to really go to the hospital and see what is happening. It's not just a matter of seeing what is happening in the media. Visit your facilities as the hospital board to check whether patients are receiving the best treatment that they should be receiving.
Certainly, and just also that our doctors are in a conducive and proper environment, because we've heard the conditions that they've had to work in. Thank you so much for your time this evening, and we do hope there is some kind of change. That was Professor Simon Nyamatandani speaking to us with regards to the state of the conditions that many of the doctors are subjected to.